The WWAY Health Fair, the free health fair, is this Thursday. We will have a lot of vendors and some information out there at Independence Mall in Wilmington from 10 a.m. until 3 p.m. As part of our lead up to the event, we're introducing you to some of the doctors who will be on hand for the event. Today, Dr. Patrick Craig talks about diabetes and the importance of establishing a primary care doctor.
When a patient comes to you, what are they looking for?
So looking to establish a primary care doctor, medical home, and to screen for diabetes, high blood pressure, and then look at your family history. So there are actually two types of diabetes, type 1 and type 2. Type 1, usually we see it develop a little bit earlier in life, and they usually always require insulin. Compared to type 2 diabetes is something that can kind of linger for a while, and that has to do more with food choices and being obese, having other types of medical issues.
And at the health fair, you're going to help people do some screening for diabetes. Tell me some of the things that that people might notice about themselves that they would want to ask you questions about.
Sure. So symptoms of diabetes can include urinating a lot, feeling you have to eat a lot, being very thirsty, vision changes, changes in weight. Family history of diabetes is also very important.
You can be pre-diabetic, am I right?
Yes, you can.
What exactly does that mean?
So that means that your body is developing an insulin resistance, meaning the insulin you have doesn't work as well as it used to. And that can be an indicator for us to get in front of it and not let you develop diabetes in the future.
So how are you going to test these people at the mall? How are you going to help them find out if they're pre-diabetic or perhaps diabetic?
Sure. So we can test blood sugar, talk about their symptoms, and then maybe refer them to a primary care provider that can do further tests.
And that would be when they would come to see you here in the office?
Yes, sir.
All right, so what are some specific questions that you'll be asking these folks?
Talk about their food choices is important, talking about their weight. Diabetes can affect your eyes, can affect your nerves, can affect your kidneys, can affect the vessels, so putting you at risk for all those different diseases. So our goals are going to be to alter diet, alter lifestyle, consider medicines by mouth, or maybe even need for insulin.
And what's one piece of advice you give everybody who is seeking health care?
Find a physician group or a specific physician that knows you and knows what to look forward to in the future.
See, can you imagine Independence Mall full of expert advice like that? It's free. It's this Thursday, y'all.